Fantastic. Hello, hello, welcome everybody. It's so great to see you all. My name is Shelley Bhattacharya, and I'm one of the physicians here at KU Medical Center. And today is our Climate Change and Health series, our community conversations. We have some folks here in the audience, as well as a number of you on Zoom, and we'll keep an eye out for the waiting room to make sure everyone can come in as soon as they can from the waiting room to our conversation today. Before we get started, I first wanted to talk about upcoming events that are coming with this series, and wanted to make sure you all are aware so you all can attend. You'll see on the left-hand side of this column are all the upcoming dates of things coming up. Next month, we have a big event coming up. It's our Sustainability and Wellness Fair. It's right here on campus. It's free. It's from 11 to 1. We'll have lots of tables set up from community nonprofit organizations interested in this, in sustainability and climate change reduction, helping where we are and helping it to be a better place to live. So if any of you would like to have a table during that fair, please reach out to myself or to Barb Manning, and we will coordinate that for you. There's no charge to be a part of the fair. There's no charge to come to the fair. But if you'd like you, Richard, if you want to have a table there, please let us know. And we'd love to have you. We'd love to have you. That's October 23rd. Please mark your calendars. It's a Monday afternoon. We made it over the lunch hour specifically, so you all can pop in during your lunch breaks. We will have free parking. For those of you that need to park in on campus, you don't have to pay for parking. So we will arrange that for you. After that, we'll have monthly events in November, January, February, and March and April. There's cut off of the screen, but we will have it throughout the end of the academic year. We also have a sustainability challenge, and we'd love to have any and all of you participate in that. And this is what it is, basically. It's an open call for ideas about sustainability in our community. It could be our campus community, or it could be in the Kansas City community. So any ideas you have to make this a better place to live for all of us would be fantastic. The more community involvement, the better. $1,200. It's not hard to get. So please come and be a part of that. There is a QR code. If you scan the QR code on your phone, that will link you straight to the website, which will link you to the sustainability challenge. If you have any problems whatsoever, please let one of us know. But we'd love to have you submit. The deadline will be in October, actually right before the fair, the sustainability fair, which was October 23rd, as you know. So please submit your application during the fairs, where you'll give a 10-minute shout out about your project. You'll present your project, and then the audience will vote on the project that they think should get funded. And we'll have 2 winners. So, and you'll know right there if you're a winner or not. So it's pretty easy, pretty fun. This is the wellness fair I was telling you about. So there's a registration link that's right there on the sheet, on the screen. We will have a keynote address by our Executive Vice Chancellor, Dr. Samari. Let's go to today. So before I introduce Amy LeBoeuf, I wanted Barb to give a shout out about a recent book that she read based on last month's community conversations. Barb, did you want to say a few words?
Sure. Hi, everyone. Welcome.
Barb, I believe you're muted.
Sorry, I am muted because I'm in the room. So Shelley, if you can mute me over there. Can you hear me, Jen?
I can. I do hear a little bit of feedback, but we can hear you.
Yeah, I'm trying to get the other one muted.
We'll just have it for the podium. How about that?
Sorry, everyone. Okay, so the book is entitled Restoring Eden. It is unearthing the agribusiness secret that poisoned my farming community. It is by Elizabeth Kilborn, and I'll add that information into the chat, but I highly recommend this read. It's deep, but she's a phenomenal writer. Cheryl had actually recommended her on our last community conversation. And just a great book. So I'll put the information in the chat, and then I'll turn it back over to Shelley.
Thanks, Barb. All right, so hopefully you all can get a chance to read that book or check it out from the library and take a good read. All right, so I'd like to introduce today's speaker. So today's speaker is Amy LeBoeuf. She is the founder and director of Louisiana One Health in Action. I wanted to give you a brief, she has an amazing bio, by the way. So just a tidbit of what she does. She is a proud Louisiana middle school educator with 25 years of experience. She's also the founder and director of Louisiana One Health in Action. She is it's a 501c3 organization. She also serves as the chair of the U.S. One Health education team under the direction of the One Health Commission. Today, she'll be speaking about One Health, the way back to health and well-being in Southwest Louisiana, insights as a mom and an educator. Let's welcome Amy. Thanks so much, Amy.
Thank you so much for having me. I'm excited to be here. Okay, I'm going to try to, let me get rid of this thumbnail view here. Okay, and then I'm going to share my screen.
Yep, we see it.
Okay, great.
This is working. Yay.
Yay. It's a love-hate relationship. It's great when it works. Okay. I'm thrilled to be here. I came to One Health. It's been a journey of the last, 5 years or so. But I kind of want to begin with telling a story of how I arrived there, and how I arrived with the inclination that it is our path forward in so many different ways, back to health and well-being as society, sustainability as our planet. But I want to start by sharing a little bit about how I arrived at knowing the power of One Health. And that was through my son's journey. I'm a K-12 educator. I teach STEM in the Sulphur area, the Lake Charles area of Southwest Louisiana. And it was my last hour at school one day. And my son, Jack, who was in 6th grade, came to me and he was like, "Mom, my stomach hurts really bad." And, and I was like, "Jack, it's 20 minutes before the bell. Can we hang on?" And you know how you kind of look at your kiddo and you're like, "Oh yeah, no, he really doesn't feel that well." So I took him down to the nurse. He had 101 fever, and I was like, "Okay, well, just lay on the floor in my classroom till the bell rings for the day." So essentially from there, he never got better. But so that Monday afterwards was Martin Luther King holiday. This was January of 2015, and I took him to the doctor that day, and I talked to his dad. He had been over there all weekend, and he said, "Amy, Jack didn't get up from the couch. I had to carry him to the restroom to go potty. I had to wake him up to drink, eat, all that." And I was like, "Oh my word, he is really sick." So, so we went to the doctor, and basically over the course of about 8 to 12 weeks, he just basically developed these symptoms. The presenting symptom was really extreme abdominal pain where he could hardly sit up, to the point where he had 5 abdominal nerve blocks. He had light sensitivity, just fever, basically flu-like symptoms, but very extreme fatigue on top of that as well. He was sleeping about 18 to 20 hours a day. And we, of course, came back and forth to the doctor during that time. They ran a number of tests, and some of them that he tested positive for but were kind of inconclusive because they were kind of, you would think he would maybe test positive for IgM, but he tested positive IgG for Epstein-Barr virus. And those titers were super duper high. And so our local physician was like, I do not understand what this means because he's clearly sick, and it's probably just viral, it'll go away. So over the course of about 3 months or so, we went back and forth. He sent us to Children's at Texas Children's Hospital. We saw quite a few doctors there, started with gastroenterology. My uncle's a pediatric gastroenterologist, and he got us in a number of places at New Orleans and at Texas Children's. And we basically got to a point where I just kept coming back because he wasn't better and he was progressively getting worse. But the local doctors said, they kind of suggested that it might be psychosomatic and that he needed a psychiatrist. And of course, as a mom, my son went from playing tournament soccer, never, hardly ever sick, normal kiddo, normal brother, ran everywhere, did all the boy things. And basically went from playing tournament soccer to a hospital bed over the course of about 10 months. And instead of pursuing them, I guess it kind of didn't sit well with me because I actually even had a nurse there tell me, Amy, he's testing negative for everything. I mean, just stop doing tests. And I'm like, he's literally not better. He can barely sit up. He's not getting any better. Now it's more widespread, symptomatically than it was originally. And so we just decided to kind of cut ties with them. And we ended up at a doctor at UT Herman, University of Texas Herman. And he diagnosed Jack. He's a neurologist, and he had kind of a whole team of neurology and cardiology. He was having so many different symptoms at the time with tachycardia, and he got to a point where he wasn't able to stand hardly, but they diagnosed him with autoimmune dysautonomia. And so basically anything that was happening, that happens automatically in your body, he was having trouble with. And pupil dilation was off. I mean, anything that was motility, that kind of stuff. So he ended up going into the hospital at Herman and was there for about a month, and he had multiple rounds of high dose IVIG and stayed there over the course of about 5 days. He had that IVIG, but he ended up staying there for almost about a month, and then continued to do inpatient rehab for physical therapy and occupational therapy there at the TIER rehabilitation program there. But basically his diagnosis was that he had an autoimmune reaction to something infectious. And so, at that point, prior to that, actually, I had really been just racking my brain trying to figure out what in the world did he get into? What caused this? I mean, how can a completely normal kid go from doing life normally to this, where the rug is just yanked out from underneath him? And of course, the only things I could even think of were that he had a tick bite when he was like 2 years old. I mean, no symptoms after that or prior to this at all. And then he had about 7 days or so before this started. It was a complete non-event, but in our world anyway, is some stray kittens showed up at our house on New Year's Eve. We were outside cooking on the back porch, and he had a little scratch from one of them that he was just kind of playing with the string, and it was just a tiny little scratch. It just nicked him, but it was enough to draw blood. And about 3 days after that kitten scratch, a little pustule formed by that. And at the time we washed it, when it initially happened, we washed it and, put Neosporin on it and a Band-Aid and just called it a day. I mean, no tears or anything. It was literally a non-event, which is why it never crossed my mind. And then when that little pustule formed, and I was like, well, is it itchy? I was like, is it a mosquito bite? What is it? Because the scratch was almost gone. And so I was like, okay, well, clearly needs more Neosporin. So just put some more Neosporin on it, another Band-Aid, and just went about it. And I mean, and I just never thought another thing about it. And nobody ever asked us about if he had any exposures to any, like, you know, vectors or animal bites or scratches or anything like that. So it was not even on my radar to think, you know, to consider it. So the high dose IVIG was very helpful, and it kind of did help to suppress that autoimmune reaction. He went, prior to that, he was in a wheelchair. He was unable to follow multi-step directions. It was literally like having a toddler again. His brain fog was so bad. I could not say to him, okay, get ready for school. He didn't even know what that meant anymore. There was a time, this is kind of when I knew we were needed to go homebound, where he just got in the car one day in his pajamas and his shoes were on. And I mean, he was not trying to be funny or anything. He didn't even know like what he did wrong. So it was just severe cognitive impairment on top of, he had Achilles tendonitis in both ankles, in both Achilles. And so anyway, we just made a point at that particular point, because he could barely stand, you know, to go ahead and adopt a wheelchair. And he was not a fan, but he just was so weak. So the IVIG did help to suppress that autoimmune reaction. And when we left the hospital on Christmas Eve, he was able to walk again, through all of that, you know, rehab that he did and through the IVIG. And so over the course of those 10 months, he was actually diagnosed with several different autoimmune or autoinflammatory diseases. Some of those that were considered were Sjogren's, rheumatoid arthritis, lupus, chronic recurring multifocal osteomyelitis. They had found some osteolytic lesions. He had diffuse bone marrow edema in his left, from his shin down into his ankle, fibromyalgia. He had we had 3 rheumatologists, and basically they had diagnosed him just having arthralgia and tendonitis basically everywhere. He had Hashimoto's, mast cell activation, complex regional pain syndrome, chronic fatigue syndrome. So it was quite a wide range of systemic symptoms at that point. This was literally, this little picture right here was probably his highlight of the day, because if you've ever had to spend an extended amount of time in a hospital, it gets very monotonous and you just kind of get depressed because it's the same thing over and over again. But this was really a highlight of the day when the therapy dogs would come along. So I just threw that picture in there because it just meant a lot to kind of get his mind off of things. So anyway, all in all, we saw probably around 30 doctors. It was over 30, but I'm not sure exactly the number, but it was across 19 different specialties. And essentially not one of them could give us an overarching reason why this was all happening to him. And we just kind of hopped around from doctor to doctor for, I would say, probably about 18 months or so. And we just got to the point where he was kind of not necessarily getting any worse, but not getting any better, but he still wasn't having the quality of life. I mean, he still had a lot of fatigue. He was able to go back to school that next year. And so it just still, like, he was still sick. He wasn't making any more progress though. And one of the things that stuck with me, you know, through this was the autoimmune reaction due to something infectious. And so I was just literally like, what in the world is that infectious thing? You know, what could it have been? And so in the hospital, he actually, after IVIG, developed this very strange rash. And that rash was very stretch mark-like, all on both outer thighs and inner thighs. And it popped up overnight. And so that was a real clue. That's this one in the middle there. But that was kind of a clue to me. And I had asked, we had an infectious disease doctor. You know, we had a lot of people in the mix, and basically they just kind of said, you know, hey, weird things happen from IVIG because they're donor cells, and maybe they're going to be seeing things that your body your own immune cells didn't see. So sometimes you have these strange reactions, cutaneously or otherwise. So I just kind of kept my eye on that, but I did get to Googling because that was really one of the first symptoms that were, I shouldn't say symptoms, but clues that was out of the ordinary, as far as like a very distinct out of the ordinary, that wasn't flu-like, I should say at the time. So anyway, I got to researching that and I came across Bartonella, which is the pathogen that causes cat scratch disease. And apparently that particular rash, and also this first one here on the left, which was actually on his back, and he has many more now since then, but on his back. But those have been associated with Bartonella. So, I was like, what's Bartonella? And I read about cat scratch disease and I was like, oh my word, that cat scratch has everything to do with this. I know it does. And then I wanted to also point out as another cutaneous sign, I have no idea why this popped up, but this was a lymphocytoma that popped up on his arm. Was the first thing that happened after antibiotics, any antibiotics at the time that he had had since being sick. So I don't know, what would have caused that. I mean, the doctor one of them had said, well, did he fall out of his wheelchair? I'm like, no, I don't know what this from. It was hard as a rock and real elevated. So these were just kind of clues that maybe something was happening, for the administration of antibiotics. And then he had that rash that popped up. And then, from there, he started having these other symptoms evolve that included like sharp shooting pains in the head, migratory joint pain, fibromyalgia, and then anxiety. My gosh, he would have these panic attacks for no reason. I mean, just out of nowhere, he'd just be sweating bullets and it wasn't any trigger. It was just sitting at home and it would happen. And then he also had eye pain and developed chronic uveitis. He was on, ocular steroid drops for, I want to say probably about a year and a half. But his chronic uveitis would be severe. It was anywhere from, if 20/20 is perfect, it was 20/80 to sometimes 2600, where he wasn't even able to see his hand in front of his face. And thank God it never happened in both eyes at the same time. It was always the left eye would go first, and then that would kind of resolve a little bit with, or that we would get it controlled anyway with ocular steroids, and then the right eye would start. So we dealt with that for quite a while during this. But anyway, we just kind of were going, into months with no real improvements, but nothing was getting, he wasn't as bad as he was initially, I should say, but he was having these new symptoms start, like the uveitis and things like that. So anyway, we got to a point where 2 different rheumatologists that were in the mix had encouraged starting Enbrel and methotrexate. Some of his cytokines had come back really high. His tumor necrosis factor, the normal range for that is 0 to 22. His was in the 3000s, and they wanted to get him started on methotrexate and Enbrel very quickly. And I tried to, I asked them a lot of questions about that because I didn't understand necessarily how it worked at the time. And I was just so reluctant because I'm like, he's never been treated for any infectious thing. If this is an autoimmune reaction to something infectious, then what happens if we suppress the immune system? Is that infectious thing that's never been treated going to be worse? And the doctors were like, no, it's probably long gone by now. This is probably just the autoimmune reaction that's still happening. So I just didn't feel comfortable with that. And it kind of really put us at a crossroads where I was just like not willing to go there until I had exhausted we really hadn't had a lot of testing done, direct testing. We've had autoimmune reactions. Autoimmune testing done, but we've had some antibody testing at that point, but no direct testing. So I wanted to kind of pursue that first before we did any type of immunosuppressive type drugs. So we just felt like it was time for a new approach and to find maybe a doctor who was a little more investigative. So we ended up, at the time I had really been researching a lot about, and I was basically reading everything I could get my hands on from Dr. Ed Breitschwert, who's a veterinary internist at North Carolina State University. And I saw that he was partnering with Dr. Bob Mosieni, who is a physician scientist, rheumatologist in the DC area. And so I basically read everything I could get my hands on from them, and they are renowned for Bartonella research, but they work together in a One Health fashion between veterinary and human health. So I guess they kind of specialized in some medical mysteries, and they understood about, that it's going to take, because of these stealth pathogens like Bartonella, it's going to take a different type of approach to testing. And then they were, I guess, because the translational medicine they were using, they just were more open-minded. And they kind of realized, since we're talking a little bit of, about climate change here, that things evolve and pathogens evolve. So I kind of appreciated that approach. And then I never really knew that you could see Dr. Mosiani as a patient until I had met one of his past patients. And I was like, I told my husband, like, we have already spent so much money. We need to be more targeted. So we decided to go see him, and he diagnosed Jack with Bartonellosis, which is the chronic version of cat scratch disease at that point. So anyway, he began some combination antibiotic therapy of, at the time, it was clarithromycin and rifampin, and it was later changed to clarithromycin and rifabutin. So he had marked gains in that. And it took about 3.5 years under Dr. Mosiani of high dose antibiotic therapy. He went much higher on rifabutin than what is probably normally prescribed. But it was so systemic that, it was in his tissue and his bone marrow and all that he just felt the need for that, and symptoms resolved on that treatment. So in total, he spent about 2 years in hospital homebound, away from school, but he has made a full recovery and is symptom free. So I'm thrilled about that. And I'm so grateful, because we've met other patients that isn't the case for. So I'm just extremely grateful for that. And he's a junior in college now. So it does my mama heart good to be able to share that update with y'all. So, as an educator, it really got me thinking, as a mom too, I should say, but, what is our responsibility? Because I have kids come to me all the time. In the past 25 years, they come up to you and they tell you everything. I teach middle school, and they're just, they tell you all the stuff, even that you don't want to know, but I've got kids that come and say, oh, I went hunting this weekend, I got a tick bite, or this cat had kittens underneath, our house or by our house. And so we let him in the house, and now we have fleas all in the house. And I was just like, what are our kids actually learning about this kind of stuff? So just, as a mom, and an educator, I got to thinking critically more so about, like, how did all this happen to Jack? And it's not just Jack, it happens to a lot of different people. So, I really felt like knowledge of patient equals clinical care choices. And what difference could it have made in clinical care choices for him if it had been known that he had a recent animal bite or scratch? Or maybe that a person might have a new pet, or recently contracted lice, or had exposure to fleas or ticks or what have you. So, I just remember always thinking, I wish that on a patient intake form that there would have been more questions, because it would have clued me in to share that information with a physician. And are there more ways that veterinarians can partner with physicians to help spread awareness of safe pet ownership? You know, because I didn't know enough that of what cats harbor, as far as pathogens go, or that 50% of cat bites end in an infection. I don't know anything about that statistically, back then. And that it takes 17 to 21 years for current medical research to make it into medical school textbooks, how are healthcare professionals going to stay up to date about current outbreaks, treatment guidelines, and research about vector-borne disease and zoonoses? So that was another thing. Like, I feel like at this point, given the amount of, whether it's AI or data repositories or something like that, there has to be a better way. And then also, any education, like in precautionary measures, like who's responsible for educating our children, our parents, new pet owners, the general public, about safe practices with animals and prevention strategies for keeping families and pets safe. And then, are there any additional knowledge competencies that need to be incorporated into education of health-related fields? So I got to really thinking about those questions extensively. And, I even went back and tried to see, like, what are our kids actually learning in K-12 health education? And I found out some very interesting things in regard to that. And I'm going to share those with you in a little bit. But, as a mom and an educator, I felt like I have to do something. So our family decided to develop and found a 501c3 that could be helpful in educating and raising awareness of One Health and One Health topics, because I really feel like it was through that One Health approach that saved Jack's life. And I don't feel like, after visiting, over 30 physicians, like, everybody's so siloed that there wasn't an overarching person like putting these things together, these symptoms together and exposures and things like that. So I feel like that One Health really was the key, that approach that can kind of expedite research and, expedite diagnosis for people and things like that. So anyway, so we developed Louisiana One Health in Action. And, I kind of, I found several One Health organizations that existed, but I wanted to add the in action part, because I felt like sometimes it was a little bit frustrating when I first started. I felt like people were just staying in their, in their own little echo chambers, and not like the general public. When you publish research, the general public has no idea. So I felt like, okay, my role as an educator can be to help bridge that gap. So that's kind of what we've been focusing on as a 501c3, is that we kind of do some local events and presentations. And we have one that's kind of our main one each year, called Walk and Wag for One Health. And basically what that is a 5K race followed by a 3K that you can bring your dog to. And then followed, after those races are done, we have a One Health fair. So we have like a dog zone, a kids zone, and an education zone. And at that, we have like local, veterinarians. We have Louisiana Wildlife and Fisheries. We have Department of Health. We have a variety of master naturalists. We have a variety of people who it's kind of just an intentional way of bringing people from all different silos together so that the general public can become educated. And each one of them has, like, it's kind of like a glorified science fair in that part. But we have Dog Zone, and the Dog Zone, there's little fun things there for the animals, for the dogs, and then you can adopt a dog if you want. And then we have, at the Kids Zone, they learn all kinds of stuff about the different cycles of Earth, like water cycle, rock cycle. They learn about soil health. They plant pansies. They learn about pollinators. There's a variety of different topics covered over there too. But it's really just a fun time and a fun way to get the general public educated about One Health topics. And then we also collaborate to help educate students about One Health. We do that at the K-12 level, and we do that in the university level by presenting. And then COVID kind of put a damper on this last one because we weren't able to go into our local news station anymore, but we had a monthly One Health Hot Topic where different people, I would kind of coordinate different people to come in and talk, veterinarians or public health advocates or something like that, to come and share about a One Health topic. So that's kind of what we do on our local level. But I did want to talk to you guys today about vector-borne disease, since we kind of started discussing that in regard to Bartonella. But, and I didn't know if, I know that it's kind of hard to stay up to date on the current, you know, stats and things like that. So I wanted to share some of them with you because, and especially in light of climate change, there's been quite a bit of uptick in cases. So for vector-borne disease surveillance cases, they've more than tripled in the US since 2004. And there's over 650,000 surveillance cases of vector-borne diseases that were reported between 2004 and 2023. And those were particular to fleas, ticks, and mosquitoes. There's also, in case you didn't know, fun fact, 17 reportable vector-borne diseases in the US, and of those, 9 new pathogens have been found since 2004. Overall, there's approximately 95% of reported cases of vector-borne disease were associated with ticks. So ticks make up the primary percentage of vector-borne disease cases. So making those the most medically important group of arthropods in the US. And then of those 95%, almost 75% are Lyme disease alone. And I wanted to just share this in case, just to refresh your memory, I guess, that these are the reportable vector-borne diseases in the US by states to the CDC.
Amy, we have a question here.
Oh, I'm sorry. Go
Is
ahead.
that okay? Okay,
Yeah.
go ahead.
So,
Can you hear Ethan? Amy?
Yeah.
Okay, perfect.
okay, so I'm just kind of getting familiar with One Health, like as a, like, I guess, overlapping of different areas of health, but I'm curious, like, on a couple things with this, do you also sort of work on initiatives to, like, help with improving, like, spaying and neutering of pets in your area, and in addition to, like, education about, like, the diseases itself, and maybe having, like, physicians come? I guess I know that was a couple questions, but yeah.
So, in regard to, like, you know, trap, neuter, release, that, you know, I mean, I particularly I don't necessarily have, I don't want to say anything to do with that, because I've talked to a lot of people locally that do have a program in regard to that. And I just haven't I mean, One Health it encompasses a lot of different topics. So I haven't necessarily been involved in that particular area, but it obviously it is a One Health topic for sure. And in regard to the physician question, can you ask that part again?
Yeah, so I mean, some of the research is kind of like heavy, and it sounds like you've had to do like significant amount of time reading to understand this. Like, physicians maybe can distill some of that, but like, what are some of the methods that you have used to kind of explain these like big systemic issues related to, you know, pathogens, you know, animal vector-borne diseases, to like the general public without like losing some of the, like, maybe the nuance and like aspects of it?
Well, I mean, to be honest, like, I did a lot of the research, you know, on my own, and I've been able, because of being involved as the chair of the US One Health education team, I've developed some relationships with people who are in research. And so, I mean, and I obviously have a natural interest in it, given what our family's been through and that kind of thing. So, you know, one of my goals as a 501c3 and a mom, for that matter, is that other patients don't have to go through what, and families don't have to go through what we did. I mean, we spent well over $100,000 in getting a diagnosis and with treatment. So, I mean, I do a lot of the presenting on my own because, to be honest, I haven't really found a lot of physicians that are in the physician realm are educated about it, because there's just simply so much to know. And to be real honest with you, I mean, even when at the beginning of Jack's diagnosis, we at Texas Children's Hospital, we saw an infectious disease doctor. And you know, I didn't know if that tick when he was 2 years old played any role in this or not. I mean, I had no idea. And so I had asked about Lyme disease, because it's a lot of the symptoms, you know, you're Googling, because I mean, we weren't really getting a lot of help.
Yeah.
And so I said, a lot of these symptoms do overlap with Lyme disease, and they are a little vague, like they sometimes have in Lyme disease. So, I mean, that infectious disease specialist actually, I mean, after a 2.5-hour drive to get there, told us that Lyme disease doesn't exist in Louisiana.
Oh.
Those were her exact words. And from there, I mean, I wish I had known at the time, which is kind of why I feel again about the One Health approach. Had I known to look at the Companion Animals Parasite Council's prevalence maps of tick-borne disease in canines, I would have seen that we do indeed have Borrelia, which is the pathogen that causes Lyme disease in Louisiana. But we also have, actually more so, anaplasmosis ehrlichiosis in canines. So had I known that at all, to even say, actually, like, so what do you think about this? I mean, could we at least get him tested? You know, so I don't really find that in general, that physicians that I come in contact with, and it could be just because of our regional area where Lyme disease isn't, you know, super prevalent. It's not like I live in the Northeast where, you know, physicians you would assume would be more, you know, familiar with that and would be helpful in regard to having them, or be more apt to want to speak or present or what have you. I mean, we do have local hospitals that support us as far as at our events and things like that. And like, I've done a couple lunch and learns and things like that with local physicians. But I mean, I just don't find that in general, at least here regionally, that physicians have been, I just feel like it's been hard for them to stay up to date with current research. I've even talked to the Department of Health here in Louisiana and talk to them about, like, what can I do to help physicians stay, you know, in the know of current research in regard to vector-borne disease. And they said that, I mean, that they actually have a lot of physicians that opt out of their monthly newsletter. So I don't know. I mean, in regard to that, I'm just trying to do what I can do on my end. And I mean, you know, I don't know. I don't know what the path forward is for that, other than just have better ways from the CDC and from state Department of Health to get the word out. And then that way it would make physicians more educated to be able to play a part of it, you know, of our initiative. I don't know if that
Amy,
helps.
We have another question here, Amy.
Yeah.
Yeah, my name is Richard, and I live in Kansas City, Kansas. And you are a fabulous person. And I really enjoyed hearing the first part of your story, just going through what you had to do to diagnose what was happening with your son. And I identified with it because I'm an environmentalist. I'm on the EPA's Environmental Justice Advisory Council. So I'm hanging out with the big cats, even though I'm a boots on the ground person. And my responsibility that I discovered in the low-income community, especially with people of color, when it comes to climate change and even these health problems we're talking about, there's they have a consciousness. You know, I came out of Cornell University online course teaching back in the inner cities of climate change consciousness. And that's what you had when something was going wrong with your son. You had a consciousness about health. And that's what people in low income communities don't have. And when we try to go in, like the kinds of solutions that's being created, which are, like you said, siloed, are trying to take them past that point to the next step. And you're trying to take them somewhere that they, like, I hate hearing people say, you got to go meet them where they at. They don't know where they at. You know, I mean, you're putting them above where they are. So I just wanted you to know, identify with you a lot in your effort to do what you did. I'm gonna make sure I get a copy of this
PowerPoint.
PowerPoint.
Sure.
Because
Yeah.
you were talking and you found them doctors that would take the time to look into it, and most of them don't. I think that's where I'm at with what I'm trying to do. They don't connect the lack of employment as a health-related issue in the low-income community. And that's one of the things that I want to be able to follow up on.
Well, thank you. And I appreciate that. Yeah, it's going to definitely take everybody working together because no one sector has all those answers. So that's the whole key about a One Health approach. And I want to talk just a little bit about, I know we were talking about Lyme disease and that's the most prevalent vector-borne disease, but I can't not say this because Bartonella is actually the most common vector is actually fleas. So first thing is that not all vector-borne diseases are reportable and they're substantially underreported. But as the science evolves, and especially in light of climate change and what it's evolving to, and some of the revelations that are coming out, I wanted to talk about flea-borne disease because I think that it's just underappreciated as a source of disease. I think that even, you know, I think people see them more as a nuisance as opposed to like a vector of disease. But and I just threw some numbers up here that I put together, but Bartonellosis, you know, AKA cat scratch disease, has about 20,000 cases per year that are reported. My suspicion, among other, with some research, and in my opinion, comes from researchers' opinions, is that it's much more prevalent than that. Especially in light of the fact that it's spread by so many vectors, fleas, ticks, lice, biting flies. But it's most often transmitted to humans after a scratch from a domestic or a feral cat. And just statistically, about 80% of feral cats are positive for Bartonella. They're considered a natural reservoir. And then plague. It's funny, as I was beginning to research more so about flea-borne diseases in the beginning of just my own journey through all this, plague was always mentioned in all the CDC PowerPoints, but Bartonella never was. And in plague, we have about 1 to 17 cases per year. It's predominantly spread by ground squirrel fleas, and it occurs mostly in Western US. Murine typhus, there's about 300 cases per year. California, Texas, and Hawaii are the most prevalent places geographically, and then flea-borne parasites, and that's considered rare. But I did want to not go on without at least mentioning these, because as the climate changes and warms and pathogens, things just, I guess, just happen that don't normally happen with climate change. But we have to be able to, as things are evolving, to be able to consider those as maybe an underappreciated source of disease. So in regard to Bartonella and Bartonellosis, I think most people are physician-wise are, attuned to cat scratch disease, swollen lymph nodes, and that kind of things. But when people don't have that particular, hallmark symptoms of cat scratch disease, like Jack didn't, that it can become overlooked. especially when we're not considering exposures. So it was originally thought to primarily affect immunocompromised individuals, but research has suggested that immunocompetent people can indeed become chronically infected, and that chronic infections can lead to cardiac and neurological complications that are life-threatening. And in case you didn't know, Bartonella is the #1 cause of culture-negative endocarditis. And research has increasingly suggested its role in chronic diseases ranging from neurovascular to rheumatologic. But I wanted you to also know that it's been associated now with 3 different types of cancers: inflammatory breast cancer, canine hemangiosarcoma, and epithelioid hemangioendothelioma. Oh my gosh, EHE. Let's just say that.
Endothelioma.
Thank you. And chronic infections are often mistaken for other disorders, as was Jack's, lupus, multiple sclerosis, etc. And they do lead to that. Because of that, it leads to additional economic and health concerns. The risk factors for Bartonella: outdoor and indoor exposure to fleas, biting flies, ticks, and other arthropods, working or living with pets or other animals. It's been interesting, I will tell you, just on an aside, working with a lot of veterinarians, how many of them have these low-grade kind of symptoms that are just chronic, and and they haven't really had a lot of help in just, they treat, a lot of people are just treating the symptoms. But could there be a potential role in some of this of a vector-borne disease that they're experiencing? And there's been some research done on that, actually. People with naturally weaker immune systems obviously are another risk factor, cancer patients included, or people with immune disorders. And then diagnosing Bartonellosis, it can be difficult due to the variety of atypical and nonspecific symptoms that somebody that's infected might have. But then also combined with that is the stealth nature of that pathogen. In fact, in one study, positive titers were found in only 30% of patients, of people who actually did test positive with direct testing. So you can see that there's some pitfalls in regard to testing, and just because of the nature of Bartonella in general, it infects at low bacteremia levels. So that throws, kind of a kink in the diagnosis part as well. But I just did want to share that specifically about Bartonella. But switching back to Lyme disease, since that's the most prevalent vector-borne disease,
Amy, I'm
Yeah.
going to give you 1 more minute, Amy, so that we can have discussions for the last 5 minutes.
Oh my goodness, I'm sorry. I talked so much.
It's been great. I just wanted to give you warning. I'll give you another minute, and then we'll open it up for discussion. Thanks.
Okay. And in regard to Lyme disease, I mean, I kind of don't know where I want to go with this now at this point, since I have 1 minute, but there's 476,000 estimated cases of Lyme disease that were reported annually in 2019, and since then it's been very similar numbers. But one of the I think the most difficult things about it in regard to funding, there's low per patient funding, federal funding for Lyme disease. It's $82 per person per patient. And then less common diseases like West Nile or malaria have way more federal funding than Lyme. So we're not able to be working with good diagnostics, or there's actually no working therapy as far as current treatments go. And then the most at-risk population, just bringing it back around to kids, is that it's actually children ages 5 to 9, followed by middle-aged men. And then just so you know, since I have just a short amount of time left, that out of those 476,000 Americans that are diagnosed with Lyme annually, 25% of them are children. And the numbers work out to 300 students every single day that are infected with Lyme. And that is 6 school buses full of children. And then of those, 5 to 20% of Lyme patients develop chronic symptoms And that can obviously impede attendance and learning. And then they'll be at risk for not just the physical things that go symptomatically, but also depression and anxiety as they fall further behind in school due to their functional limitations. And then in regard to climate change, there are just a number of different things that I wanted to talk about, but basically climate change can affect the transmission dynamics, the geographic spread, and the re-emergence of vector-borne diseases through multiple pathways, including direct effects on the pathogen itself, the vector, and non-human hosts and humans. And in addition to having direct effects on individual species, climate change can also alter entire ecosystem habitats, including urban habitats, which vectors or non-human hosts may thrive or fail. They have a longer life cycle ability because of the mild winters and early springs, the warmer temperatures, and then the increasing geographic ranges. And I wanted to share this with you guys, and I'm happy to share this as a link as well. And so that you guys can have this. This is a CME that's also offered from Invisible International, but they developed this health, zoonotic, and environmental risk assessment tool that as I was saying earlier, that I wish they had a patient intake form that would kind of help put some of these diagnoses on the radar for physicians, but also would prompt me as a patient to share information with the doctor if we're seeking, like winter flu symptoms, not the flu. So this is a great tool that I kind of wanted to just share with you guys. And then at the federal level, the K-Hagen-Tick Act, I just wanted you to know there is some hope here. The K-Hagen-Tick Act, the CDC and the OASH are leading they're co-leading an interagency effort with more than 15 civilian agencies and the Department of Defense to produce an inaugural national strategy for Congress for vector-borne disease by this coming December. So there's some hope here on the horizon. And then I did also want to talk about the National Health Education Standards. And I'll just give you a super short version if I could just have a few more minutes. But essentially, as an educator, when I was talking to you guys about what are our kids learning about vector-borne diseases and other One Health topics, I want to just tell you it's not much. The National Health Education Standards for K-12 students was developed in 1995 and has had no changes in 30 years. They're written very generally, which is good, I guess, because you can tailor them to geographic areas or ethnicities or something like that. But in doing that, it kind of just glosses over so many things, and kids aren't getting the kind of health literacy that they need. The outcome of those national health education standards is to produce health literate adults. And we can kind of see how that, since the world got a crash course during COVID of health literacy, you can kind of see how that played out. We have a very big gap in health literate people. So I feel like going back and kind of framing those national health education standards in One Health would give students a better understanding about our interconnectedness with animals, plants, ecosystem, and the environment, because all these kids are going to grow up and be in all different types of occupations, and that are going to need to take a transdisciplinary perspective in problem solving. There's no mention of vector-borne diseases or zoonoses or how to prevent them in the National Health Education Standards. And so there's also no conceptual understandings of how our human choices can impact our environment in ways that can directly affect geographical ranges of disease-carrying vectors. And I know I'm kind of using vector-borne disease as an example here, but you can see how that can play out into a wide variety of other topics as well. And then, of course, that results in adults who don't think critically about the environment and our relationship with animals and our ecosystems as well. I was going to talk to you just, and I can make a stop here, but
Thank you,
I was-
Amy. That was
yeah,
wonderful.
that's okay.
Yes,
Yeah.
yes. And I think that national health education strategy, that could be a place that we could look into even here in Kansas City to look and see how can we approach our school district, to see how
Yes.
we can approach our K-12 local schools here in implementing an updated health education syllabus to what they have right now. So if anyone's interested in that, that's here today, we can talk about that and we can see how we can do that with the K-12 education here.
Yes, and I would love to help, if you need some
Yeah.
background info and that kind of thing too, I'd be willing to
Sure.
meet with whoever.
Sure, sure. Well, thanks so much, Amy. I know it's past 1 o'clock now, so
Oh
but
my
I couldn't
goodness.
stop you. You had so many cool things.
I'm so sorry. I have more
no, it's
too, and I
okay.
feel bad I
It's
didn't get to
And I
everything.
think we need to have you back again to do the second half, because there's so much great information, and
Right.
sorry that you have to be
Yes.
cut off on this, because this is,
Right.
it's so informative and educational, and thank you so much for your time. It's so impactful. It's one of those things that's really hard for me to listen to, because when I think about people from marginalized communities, or people who don't have the money to continue to advocate for themselves and
Yeah.
investigate and find out what's going on, and we're so lacking. You're so right in that, those silos, and if we could just get everybody to work together to share this information,
Yeah.
it just seems like it would be so extremely beneficial. But I was truly enlightened. Thank you so much for sharing.
You're welcome. And I'm just so appreciative. I mean, and that you guys had me. And I mean, I do have a whole other part to this, but in case no one knew where I was from, Lake Charles, experienced 4 natural disasters on top of a pandemic. So I did want to talk about that as well. But I mean, again, I'm happy to share my slides. It has all that information in there, and I can share some links to that health tool from Invisible International. They have a CME that's free. That's another thing I wanted to share as well.
Great.
But
That would be
yeah,
great.
thanks so much for having me.
I've already begun, when I see my patients, I'm a geriatrician, so all my patients are over 65, but I've begun incorporating exposures, animal exposures, new pets, when I'm doing new patients, really not just new patients, but anyone that has something that's a mystery that I need to figure out. So that's from Cheryl's talk last month, and also from you. So,
Awesome.
and you're right about kids. Like my daughter yesterday picked up a wild bird that had an injured wing and kept it.
Oh my
Got a
gosh.
cage, got a toy cage for one of her toys, brought it down, and babied her and fed her bird seed and water. And that little it was a finch. We looked it up. It was a goldfinch. Didn't take any of the seed, didn't drink any of the water.
Oh no.
And we finally convinced my daughter to put it back where she found it, which was hidden under the sunflowers in our yard.
Oh,
And
yeah.
she was so sad. She cried and cried and cried that she had to give up her bird. And she even named her bird. But she
Oh,
may have gotten scratched by that bird. She may have, who knows, right? So
right.
I have to do a full skin check when I go home today and make sure she's okay. But yeah, it's so true. Kids get involved in so many things that you may or may not know about.
Right.
I have a really quick question, especially in light of Cheryl's conversation
Sure.
last week. So because we're hearing this alignment with like hospitals and clinics and things like that, is there a one page that you all have put together that could be like the patient intake form, but questions that would be very specific that could be provided that we could share out with various providers and clinics and institutes? Is that already been done?
That health tool, is that what you're kind of talking about?
Is
Something?
and that one I know was specific to the category of person. I guess what I'm thinking from the patient perspective is if it's, and I don't mean to dumb it down, but are there
No.
like 5 top questions that need to be asked, or something that in that intake form could be shared, posted, like in those clinician rooms, or even in a waiting room, as people are just sitting there? Is there something that's been developed?
Are you talking about that would put One Health related diagnoses on the table? like in that,
Not
or,
necessarily the diagnoses, but maybe the thought process because these are things to me that people don't always think about, you know, awareness of, oh gosh, I forgot, yeah, I was scratched by a cat 2 weeks ago, I didn't even think anything about it. And, you know, and again, I'm not trying to oversimplify it, but just something that could possibly be used as an additional resource to spur on that level of consciousness for people to be thinking about, but also for providers to be thinking about as we progress in a lot of these disease states.
so you're talking about from the patient perspective.
Yes.
I
Okay.
think, Amy, this is Cheryl, so I've been listening in and having a delight. So I think what she's asking about is what questions could be included on a patient intake form. And Barb, I had included a list of those questions at the end of my presentation. We might not have gotten to cover them, but they were in the slides that I shared. So the
Right.
top 5 would be, do you live or work with animals? If so, what animals are they? Do you sleep with your pets? Are there any animals in your life that are sick? Are your animals up to date on their vaccinations? Has anyone been bitten or scratched? So those are the kinds of things. And, you know, Amy and I are happy to come up with a list to share with you guys if you're interested. But I bring those forward every time I'm talking to a human health audience, because people want to know, what am I supposed to do? What should I, you know, what can I do to help us here? So sorry, I just had to jump in and share that with you.
Thank you for the reminder. I have a lot going through my head with everything I've got going on, so I apologize. Yeah, you did address that. And I think maybe what we need to do is just come up with a one-page resource that we could even disseminate. I work a lot with the school districts and with students and pathways teachers, and so I would love to share something out to them as well. And even like our nurses and counselors, I mean, how often, you know, I know Amy, you're an educator. I mean, how often do kids present situations that are just so unknown? But so I think if we had something like that, it would be extremely beneficial.
You know, I want to throw this in because of my work outside of the hospital with your in the community. A wet man, and Amy, I work with middle school age students, so when you said that, I identified with that too. But we wanted to build a wetland, a demonstration wetland, to be able to expose them to science, maybe in many cases in the inner city for the first time in their life. And we want to build it into the school system where the teachers are coming up with them. And what we want to be able to do now that I'm listening to both of you two talking is to build in these concerns that we should have about bat caves or salamanders or whatever you have there from the demonstration standpoint. Again, dealing with the consciousness that even though you may love all this, understand that within the context of this type of a circumstance, there are other things you need to be aware of too. So I'm learning a lot of this. I appreciate it.
Well,
I
that's
see a good
great.
grant opportunity there.
Yeah.
That's where the community comes in. You know, we talk in terms of hospitals, we talk in terms of the schools. But the community has a major role in this. The community needs to, Mama needs to become what you are, and stay on that subject until she fulfills her concern. That's what you did. Regardless of what the precisions are saying, you still have a concern, and maybe we need to go a little deeper. And that's what they need to know.
Well, thank you. I appreciate that. I'm glad that you came today. In fact, did you say you're in the environmental
Oh yeah, I'm in the
realm? Yeah. So
yeah.
if you, I'm going to send my slides to Dr. Shelley, and to Barb, but I wanted to let you know, like, further into this, I start talking about my slides kind of start talking about Southwest Louisiana, what we've been through as a community in regard to the natural disaster, that 2 hurricanes we had back to back, and then the ice storm, and then the flood and all that. But it also, there's a part in there where it talks about that you probably know what nacho is, but basically that up to 80%, I believe, of vector control programs across the US are not prepared for the increases in vectors like mosquitoes, ticks, fleas, all that kind of stuff, and what we can do to, you know, prevent those numbers from rising as, you know, they become more, the word just left me. The resistant, I guess is what I'm trying to say, is resistant to those, types of programs that whatever they're using, pesticide wise or what have you. But so anyway, that's a whole other thing as well. But yeah, it's going to take, no one sector has all the answers for sure. We've got to be able to work together.
Kansas City got hit with them this summer and right now. And also include the spiders and the Lyme disease. We just made a comment on the news the other day, tell people to be careful because it's starting to grow and be aware of it. But that's the end of the comments that were made. And that might just be one newscast. They said it, and that was it. I'm saying, it's going on as we speak. When you started talking, I went, that's what we're dealing with right now.
Right.
Well, I'll pass your information over to James, but you'll have her information.
Oh, yeah.
Okay. Perfect.
Okay, thank you again.
Perfect, Richard.
We so appreciate it. This was.
Well, I'm sorry I was so long-winded. My gosh.
It was wonderful. It was
Yeah.
good. Shelley needs to have you back.
Yeah. I would be happy to have you back, Amy.
Anytime, it's fine. Yes.
Tell me when, your schedule, when you have a good opening in your schedule, and we'd be happy to have you back. Yes, absolutely.
Okay.
And then, we are trying to do the same thing as your 501c3, as far as garnering as much community support and support here at the medical center to get students as well as community leaders, faculty, staff working together when it comes to climate change and health. So I know what you mean by it. It's just, it can be challenging to kind of round up the forces because everyone thinks about it, everyone cares about it, but not everyone has the time for it. So we can also talk about how we can, get some things going in the community to help engage other folks, I'm really trying to engage other physicians and they're interested, but they just don't have the time. And I get that. It's hard to find the time for it. So.
Right. And I mean, of course, and I don't want to, pester anybody or, if they don't feel comfortable talking about it. And I know Lyme in and of itself has had some controversy, surrounding it. So when you start talking about vector-borne diseases, I mean, I've even talked to our state veterinarian, public health veterinarian, and, and he said, well, I don't want to, make people think we're having a big Lyme outbreak. And I'm like, I'm not talking about Lyme disease necessarily. I was talking about Bartonella actually at the time. So, but I think it's, I think they don't want people to be,
alarmed.
Go into panic
alarmed
mode.
about it. But they need to be educated about it. That's the whole thing.
Yes, exactly. All right. Well, take care, everybody. Thank you so much.
Thank you. Appreciate
See
y'all.
you. Please join us for future programming, and it'll be back up in November since we have our sustainability fair next month.
Okay, that sounds great.
Okay.
Y'all have a great time. Bye, Shelley. Bye,
Bye,
Barb.
bye. Thanks,
Bye.
Amy. Bye,
Bye,
Cheryl.
Cheryl.
Bye, Barb.